Before we begin, a quick note. The opinions and analysis shared on Truth Seekers are our own interpretations of published research and should not be used as medical, financial, or professional advice. Always consult qualified professionals for decisions affecting your health or well-being.
And with that out of the way, welcome to Truth Seekers. I'm Bill Morrison.
And I'm Alex Barrett. Today is November 10, 2025, and we're talking about the shingles vaccine that promises to prevent dementia.
Let's get to the truth.
Right, so there's this headline going around that says the shingles vaccine could reduce your risk of dementia by 20%. And I saw it everywhere. BBC, New York Post, even Oxford University's own press release.
Yeah, and I get why that's massive news. We're talking about potentially preventing cognitive decline in millions of older adults. Dementia is one of the most feared diagnoses.
Exactly. My grandmother had Alzheimer's, and watching that happen to someone you love, you do anything to avoid it. So when you see get this vaccine, lower your dementia risk, of course people pay attention.
And honestly, when I first saw the study, I was excited. It's published in Nature Medicine, which is a top tier journal. Large sample size, over 200,000 participants. The researchers are from Oxford, Stanford. This isn't some fringe claim.
Which is what makes this so tricky, because the study is real and the association they found is real. But what the study actually says and what those headlines claim are two completely different things.
Okay, so let's start with what they actually did. The researchers looked at electronic health records from about 200,000 people in the US. They compared two groups: people who got the newer Shingrix vaccine and people who got the older Zostavax vaccine. Then they tracked them for 6 years to see who got diagnosed with dementia.
And they found that people who got Shingrix had fewer dementia diagnoses. That's the association.
Right. Specifically, they found that the Shingrix group had 17% more diagnosis free time than the Zostavax group. When they compared Shingrix to other vaccines like flu or Tdap, the numbers were even higher, around 20 to 27%.
So that's where the headlines get vaccine reduces dementia risk by 20%. But here's what I'm actually wondering. When they say diagnosis free time, what does that mean?
Wow, that's actually a critical detail that gets lost. They're measuring the time people lived without receiving a dementia diagnosis, not the time they lived without dementia itself. And those are not the same thing.
Hang on. So, what you're really saying is they're measuring when someone gets diagnosed, not whether they actually have the disease.
Exactly. Because dementia doesn't just appear overnight. There's often a delay between when cognitive decline starts and when someone gets formally diagnosed. And who gets diagnosed often depends on who's getting screened.
Right. And the people who are engaged enough with their healthcare to get a brand new vaccine, they're probably also the people who are going to their annual checkups, getting cognitive screening, seeing their doctors regularly.
Which creates what we call detection bias. The vaccinated group might actually be getting diagnosed earlier because they're more engaged with healthcare, not because they're developing dementia later.
That's brilliant because it flips the whole thing. It looks like the vaccine is preventing dementia, but it might just be that we're catching dementia earlier in the people who are health conscious enough to get vaccinated.
And the researchers actually acknowledge this. In their paper, they explicitly state that diagnosis free does not mean disease free. They know this is a limitation,
But that nuance never made it into the headlines, did it?
not even close. The Unite Post literally said this vaccine lowered seniors' dementia risk. Past tense, established fact. No might or could about it.
And that's what I saw when I was working in journalism. The actual research would be careful and qualified, but by the time it became a headline, all those caveats disappeared because vaccine might be associated with diagnosis timing differences, doesn't get clicks.
Okay, but let's talk about the bigger issue here, which is the study design itself. This is an observational study, not a randomized controlled trial.
For people who don't live and breathe research methods, what's the difference?
In a randomized trial, you take people and randomly assign them to get the vaccine or not. That randomization evens out all the differences between groups. But in an observational study, you're just looking at people who chose to get vaccinated versus those who didn't. And people who make different choices are already different from each other.
So the people who rushed out to get Shingrix when it came out in 2017, they're not the same as people who either got the older vaccine or skipped it entirely.
Right. And this is where it gets really interesting. The researchers tried to account for this by using something called propensity score matching. They controlled for 60 different variables: age, sex, race, medical conditions, vaccination history, all sorts of stuff.
That sounds pretty thorough.
It is thorough. For observational work, it's good methodology. But here's the problem: propensity score matching can only control for things you measure. And there are huge dementia risk factors they couldn't measure,
Like what?
like how much people exercise, what they eat, whether they do crossword puzzles or read regularly, their social engagement, their sleep quality, whether they've had their hearing checked. And by the way, treating hearing loss can reduce cognitive decline by almost 50%, according to a trial that came out last year.
And all of those things, the Mediterranean diet, staying physically active, being socially engaged, those are exactly the kinds of things that health conscious people who get vaccines do.
Exactly. The researchers even acknowledge in their paper that they have sparse information on socioeconomic and lifestyle factors, but those are the major modifiable dementia risk factors.
So we've got a group of people who are more likely to exercise, eat well, stay socially engaged, and get preventive health care. And we're comparing them to people who do those things less. And then we're surprised when the first group has less dementia.
That's healthy vaccinee bias in a nutshell. And we've seen this exact pattern before.
How so?
For decades, observational studies showed that flu vaccines reduced all cause mortality in elderly people by 50%. 50%! That would make the flu vaccine one of the most powerful interventions in medicine.
But I'm guessing that didn't hold up.
It didn't. When researchers looked more carefully, they realized that elderly people who choose to get flu vaccines are systematically healthier than those who don't. They're more mobile, more engaged with healthcare, have fewer chronic conditions. The 50% mortality reduction wasn't the vaccine, it was the underlying health differences between the groups.
And no randomized trial has ever shown that kind of effect.
Exactly. And here's the thing: the Taquet study, the shingles one we're talking about, shows Shingrix is protective not just against dementia, but when they compared it to flu vaccine and Tdap vaccine, it still looked better. When a single intervention appears protective against wildly different outcomes, that's usually a sign you're looking at selection bias, not a specific biological effect.
Because the vaccine itself isn't doing something magical. You're just identifying a group of particularly health conscious people.
Right. Now, to be completely fair, the researchers are aware of these limitations. In the paper, they explicitly state, and this is a direct quote, "This study is observational and causality cannot be demonstrated."
Sorry, what? They say right in the paper that they can't prove causation?
Yep. They also say the mechanisms by which the shingles vaccine might protect against dementia remain unclear, and that the link between herpes zoster infection and dementia remains debated. They even end by saying their findings provide a rationale for conducting a randomized controlled trial to confirm the findings.
So they're saying, we found an interesting association that deserves more rigorous testing. And the headlines turned that into vaccine prevents dementia.
That's exactly what happened. And there's one more detail that makes me think we're not looking at true prevention here. The researchers found that the protective effect gets weaker over time. By the end of the 6 year follow up, it had basically disappeared in some analyses.
If the vaccine were actually preventing dementia, wouldn't the effects stick around?
You'd think so. The authors themselves suggest the vaccine may delay dementia onset rather than prevent it, which, if true, means you're getting dementia at 85 instead of 84. That's very different from preventing it entirely.
Right. And that's not what people hear when they read vaccine reduces dementia risk by 20%. They're thinking prevention, not a slight delay.
And this matters because millions of people over 65 are reading these headlines and thinking they should get Shingrix specifically to prevent dementia, which is a healthcare decision based on a misunderstanding of the evidence.
So, what would we actually need to see to prove this works?
A randomized controlled trial. You'd take a large group of older adults and randomly assign half to get Shingrix and half to get a placebo. Then you'd follow them for 10, 15 years, giving them regular cognitive testing, not just waiting for diagnoses to show up in medical records.
And measure actual cognitive decline, not just who gets a diagnosis when.
Right. And you'd need to see if any protective effect persists over time or if it fades. That's the gold standard. Until we have that, we're just looking at an interesting correlation.
Does that mean the whole thing is rubbish?
No, actually. The association is real and statistically significant. It's been replicated in multiple countries using different study designs. This isn't fraud or statistical noise. There's something here worth investigating.
But investigating is different from claiming we know the answer.
Exactly. And honestly, there are plausible biological mechanisms. Herpes viruses can affect the nervous system. Neuroinflammation is implicated in Alzheimer's. It's reasonable to hypothesize that preventing viral reactivation might have cognitive benefits, but a hypothesis isn't proof.
And jumping from hypothesis to headlines that say vaccine prevents dementia is exactly where the problem is.
Yeah. And here's the thing, if you're over 65, you should probably get Shingrix anyway, because it's genuinely effective at preventing shingles, which is incredibly painful. That's proven. Just don't expect it to prevent dementia, because we don't have evidence for that yet.
So the takeaway isn't ignore this research, it's understand what the research actually says versus what the headlines claim.
Right. This is how science actually works. You find an interesting signal, you design rigorous studies to test it, and then you draw conclusions. The problem is when journalists and sometimes even university press offices skip straight to the conclusions.
And when I was in journalism, I saw this constantly. The actual paper would be careful and qualified, but the press release would hype it up. And then the headlines would hype it up even more until what the public sees is completely disconnected from what the researchers actually found.
And for something like dementia, where people are desperate for answers, that gap between the science and the headlines can really affect people's healthcare decisions.
So, next time you see a headline about a miracle intervention for dementia or any major disease, ask yourself, is this from a randomized trial or is it observational? Are they measuring the disease or just diagnoses? And are there obvious confounders they couldn't control for?
And check if the researchers themselves are making the same claims the headlines are, because in this case, they absolutely weren't.
The researchers were careful, the headlines weren't, and that difference matters. Right, that's all for today's dive into the data. Just remember, everything we've discussed is our interpretation of published research and shouldn't replace professional medical advice.
Absolutely. If you're dealing with health or mental concerns, talk to your doctor, not just us data nerds on a podcast.
I'm Alex Barrett,
And I'm Bill Morrison
and we'll see you next time.
on Truth Seekers.
Until then, question everything.
But verify with data.